Have you ever pondered the subtle transformations that signal the twilight of an elderly person's life? We are about to unveil 5 critical indicators that often manifest a year before an individual's final transition. If you're watching this video, comment signs right now to let us know you're here. Many of us mistakenly believe that the end of life in old age occurs abruptly, without warning. However, the human body, in its intricate wisdom, frequently provides discreet clues, sometimes months, occasionally even a full year, before life reaches its ultimate chapter. The challenge is that these initial signs often appear insignificant, easily dismissed as mere aspects of the natural aging process. It's typically only in retrospect, when families look back, that they discern the clear signals that were present all along. By then, precious opportunities to prepare, to forge lasting memories, and to provide comfort may have slipped away. In this comprehensive video, we're going to delve into 5 pivotal signs that frequently emerge in the 12 months preceding an elderly individual's passing. Some of these may be alterations you've already observed, but perhaps brushed aside as inconsequential aspects of growing older. Others might be changes that seem minor on the surface, but in reality herald the body's progressive decline. Recognizing these crucial indicators early on empowers you to offer superior care, cherish invaluable moments, and, most importantly, ensure that your cherished loved one's concluding stage of life is imbued with serenity, respect, and tranquility. Remain with us until the very end, as these 5 signs can significantly aid your emotional and practical preparation for what lies ahead. When you comprehend these unfolding processes, you won't be caught off guard. Instead, you'll be able to maximize the precious time you have remaining with those you hold dear. Now, let's commence our exploration. 1. Profound and unintended weight diminution. One of the earliest and most telling indicators that an individual may be nearing the final year of their existence is an unexplained, significant reduction in body mass. Initially, this might seem inconspicuous: a belt that suddenly requires tightening, clothing that appears more capacious, or a once robust appetite that gradually wanes. Many families tend to rationalize this as an unavoidable consequence of advancing years, but the reality is, losing weight without conscious effort is seldom a positive sign. It often signals that the body is no longer efficiently absorbing vital nutrients, muscle tissue is diminishing, and essential physiological systems are decelerating. While aging naturally brings about some degree of muscle loss, when this occurs with undue rapidity, it suggests a more profound underlying process. The body may be struggling to assimilate food properly, or the individual might no longer be able to metabolize protein effectively, leading to muscular atrophy. This reduction in physical strength doesn't just impede mobility, it significantly elevates the risk of falls, compromises the immune system, and renders the person more susceptible to infections. Another contributing factor to weight loss in the concluding year of life is marked changes in appetite. Many elderly individuals simply don't experience hunger in the same way they once did. Their sense of taste may diminish, food might no longer seem appealing, and they could begin skipping meals or consuming considerably smaller portions. This isn't merely a matter of personal preference, it represents a physiological shift. The body, sensing its gradual shutdown, no longer prompts the brain to seek sustenance with the same frequency. The consequence: reduced energy, diminished strength, and a progressive deterioration in overall health. Furthermore, underlying medical conditions play a significant role. Unintended weight loss is a prevalent symptom of chronic ailments such as malignant growths, cardiac insufficiency, or renal disease, all of which can advance for an extended period before more overt symptoms manifest. Even conditions like clinical depression or cognitive impairment can lead to reduced food intake, initiating a downward spiral where the body fails to receive adequate fuel to sustain itself. Some families attempt to address this issue by encouraging their loved ones to eat more, offering preferred dishes, or supplementing meals with nourishing beverages. However, if the weight continues to decline despite these earnest efforts, it's crucial to acknowledge that the problem extends beyond dietary habits. It signifies the body's preparation for a deeper, more fundamental transition. At this juncture, attempting to force large meals may prove counterproductive. Instead, prioritizing comfort, easily digestible foods, and adequate hydration can make a more significant difference in preserving the individual's quality of life. If you observe substantial and unexplained weight loss in an elderly loved one, particularly if they are eating less, feeling weaker, or struggling to maintain their usual level of activity, it is imperative to pay close attention. This is not merely about physical appearance, it's about the body conveying a vital message. Comprehending that message now can help you navigate the forthcoming journey with clarity, compassion, and the capacity to render every remaining moment deeply meaningful. Comment "weight change" if you found this discussion on weight loss insightful. 2. Overwhelming fatigue and debilitation. A profound and persistent weariness that remains unalleviated by rest is one of the most conspicuous alterations in the year leading up to the cessation of life. This isn't merely feeling a bit tired after a demanding day. It's an intense exhaustion that renders even the simplest tasks Herculean. Rising from bed becomes a monumental challenge. Traversing a room demands immense effort, and activities that were once routine, such as preparing meals, getting dressed, or even sustaining a conversation, begin to feel excessively draining. This isn't simply a product of aging. It's an indication that the body is conserving its diminishing energy reserves. As the function of internal organs begins to wane, the body commences prioritizing what is most essential. The heart's pumping efficiency decreases, circulation becomes less robust, and muscles no longer receive the same level of oxygenated blood they once did. This explains why many elderly individuals in their final months experience pervasive weakness, unsteadiness, and an inability to maintain their former level of engagement. Another critical factor is metabolic deceleration. The body is inherently designed to generate and utilize energy, but as it readies itself for its ultimate phase, that energy is redirected. Instead of fueling movement, the body shifts towards preservation. This is why someone in decline may begin sleeping more, requiring longer naps during the day, and finding it increasingly difficult to remain awake for extended periods. Some individuals may even experience sudden, dramatic drops in energy, appearing perfectly fine one moment but utterly depleted the next. Perhaps the most poignant aspect of this process is the emotional toll of such debilitating fatigue. Many seniors who once prided themselves on their autonomy begin to experience frustration or even embarrassment at their inability to perform familiar activities. They may withdraw from social interactions, avoid conversations, or cease engaging in cherished hobbies, not because they no longer care, but simply because they lack the requisite energy. This can unfortunately lead to a self-perpetuating cycle of isolation, where they completely cease attempting to engage, which only accelerates the decline. For family members observing a loved one transition from active and engaged to exhausted and reclusive, it can be heart-wrenching. It's easy to mistakenly assume they are being unmotivated or that they simply need to exert more effort. But the reality is that coercing activity will not be beneficial. What truly matters is comprehending their limitations, allowing them to rest when necessary, and making their remaining days as comfortable and serene as possible. If you observe a loved one experiencing profound, unremitting fatigue that is not alleviated by rest, interpret it as a signal that their body is undergoing a significant metamorphosis. This is a crucial time to cherish dialogues, cultivate moments of tranquility, and provide unwavering support without imposing expectations. Ultimately, what truly matters is not the extent of their physical capabilities, but that they feel cherished, comprehended, and at peace. Comment "endurance shift" if this explanation resonated with you. 3. Escalated cognitive disorientation or social retreat. As an individual approaches the ultimate stage of life, one of the most striking transformations can be observed in their cognitive faculties, communication patterns, and interpersonal interactions. You might notice that someone who was once sharp and actively involved begins to exhibit more frequent memory lapses, struggles to follow conversations, or appears disoriented in familiar surroundings. They may repeat themselves, forget familiar names, or lose track of time, even if they had no prior history of memory issues. These subtle cognitive changes can commence months, or even a full year, before death. This is not simply everyday forgetfulness. The brain, like all other organs, requires a consistent supply of oxygen and nutrients to function optimally. However, as circulation weakens and the delivery of oxygen to the brain diminishes, cognitive function inevitably begins to decline. The person may become easily confused, experience difficulty making decisions, or struggle to recognize individuals and places they have known for many years. In some instances, they may even experience brief periods of mental clarity followed by sudden episodes of confusion, almost as if their mind is intermittently fading in and out. Another prevalent sign is emotional withdrawal. An individual nearing the end of their life often loses interest in social engagement. You might observe them speaking less, interacting less, or spending extended periods simply sitting in quiet contemplation. It is not that they no longer care for their loved ones. Rather, their brain no longer processes emotions and social interaction in the same manner. Conversations become tiring, loud environments feel overwhelming, and eventually, many seniors retreat into their own internal world. You may also notice alterations in mood and behavior. Some individuals become more irritable, anxious, or easily frustrated. Others appear unusually placid, detached, or indifferent to matters that once held great significance for them. This is not merely a shift in personality. It is often a consequence of the brain adjusting to the body's overall decline. As cognitive function slows, emotions become more challenging to express, and the person may cease reacting to situations in their customary way. For family members, this particular stage can be exceptionally challenging. Witnessing a loved one lose touch with reality or emotionally distance themselves can feel akin to losing them before their actual passing. However, it is crucial to remember that this is beyond their conscious control. Instead of attempting to draw them back into conversations, the most beneficial approach is to meet them where they are. Speak gently, offer reassurance, and understand that even if they do not always respond verbally, they can still perceive and feel your presence. If a loved one is becoming increasingly forgetful, more confused, or less engaged, do not overlook these signs. These are frequently early indications that both the body and mind are preparing for the ultimate transition. This is a time for patience, for cherishing quiet moments, and for focusing on creating an environment that feels secure, familiar, and peaceful. Because even when words recede, the profound sentiments of love and comfort can still be profoundly felt. Comment cognitive shift if you're finding this information helpful. 4. Recurrent infections and protracted healing. As the body commences its gradual winding down, one of the clearest physical indicators is a compromised immune system. You might notice that someone who rarely experienced illness previously now appears to succumb to every passing cold, every influenza strain, every minor infection circulating. What were once trivial ailments now necessitate significantly longer periods for recovery, and simple injuries, such as a small abrasion or bruise, heal at a discernibly slower pace. These changes are not coincidental. They signify that the body is no longer capable of defending or repairing itself with its former efficacy. One of the most significant concerns is the prevalence of repeated infections. Pneumonia, urinary tract infections (UTIs), integumentary skin infections, and even oral infections become more common as the immune system weakens. Many families mistakenly assume these are isolated occurrences, but when they begin to manifest frequently or require extended periods to resolve, it often indicates that the body is losing its capacity to mount a robust defense. Even antibiotics, which once yielded swift results, may seem less potent. The individual may require more potent medications, prolonged recovery periods, or multiple courses of treatment for infections that previously would have been minor. This occurs because as circulation slows and organ function declines, the body simply does not respond to therapeutic interventions as effectively. Another frequently overlooked issue is the development of chronic wounds. If you observe that small scratches, sores, or contusions are not healing properly or repeatedly reopen, it could signify compromised circulation. Insufficient blood flow means that oxygen and essential nutrients are not reaching the skin and tissues efficiently, making the healing process considerably slower than usual. Pressure ulcers, particularly for individuals with reduced mobility, become a serious risk and can lead to dangerous infections if not meticulously managed. What is even more concerning is that infections in the concluding year of life often do not present with typical symptoms. Instead of a high fever, an elderly person may simply appear more lethargic than usual, more disoriented, or exhibit reduced interest in consuming food. In fact, for seniors, a sudden decline in mental acuity is often the initial warning sign of an infection, even before other classic symptoms appear. This underscores why recognizing these subtle changes early on can profoundly impact the level of comfort and support they receive during their final stage of life. For families witnessing a loved one endure recurrent infections, it can be both frustrating and emotionally taxing. There is a natural inclination to advocate for aggressive treatments, hoping that one more round of antibiotics or another hospital admission will rectify the problem. However, at a certain point, the emphasis frequently shifts from curative measures to comfort care, ensuring adequate hydration, maintaining clean and moisturized skin, and minimizing physiological stress on the body can contribute more to their overall well-being than another course of medication that may only prolong discomfort. If you are still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I highly recommend you subscribe and activate the notification bell so you don't miss any of our future videos. Your support empowers us to continue creating informative and inspiring content. Now, let's proceed to the next crucial sign. 5. Significant alterations in respiration and blood circulation. One of the most telling indicators that the physical form is preparing for its ultimate stage is a discernible shift in breathing patterns and the efficiency of blood flow. You might observe that your beloved individual breathes more slowly or with diminished depth than before. At times, they might pause between breaths, or their breathing could become erratic, unexpectedly accelerating and then decelerating. Some individuals experience a gentle, rhythmic breathing pattern known as Cheyne-Stokes respiration, where periods of deep, rapid breaths alternate with prolonged pauses. These changes may begin subtly, but over time, they become more pronounced and occur with greater frequency. Another common sign is the weakening of circulation. You might notice that their hands, feet, or even their nose and ears begin to feel cool to the touch. The skin may take on a pallid, bluish, or mottled appearance, especially around the digits. This occurs because the body is prioritizing blood flow to its core vital organs, thereby reducing circulation to the extremities. It serves as a clear indication that the heart is not pumping with its former vigor. Some individuals also experience increased shortness of breath, even with minimal exertion. Simply sitting upright, speaking, or shifting positions might cause them to feel breathless or winded. You may observe them breathing through their mouth more frequently, or they might suddenly need to pause and catch their breath mid-sentence. If they were once able to traverse a room with ease, but now struggle to do so, it suggests that their pulmonary function may be declining. In certain cases, the accumulation of fluid in the lungs can make breathing more arduous. This can manifest as a persistent cough. Gurgling sounds sometimes referred to as the death rattle, though it is often a benign process, or even a sensation of tightness in the chest. Many people mistakenly attribute this to common congestion from a cold, but in elderly individuals nearing the end of life, it is frequently a sign that the lungs are weakening. This can make lying flat uncomfortable, and they may prefer to sleep propped up on pillows or in a reclining chair to alleviate their respiratory distress. For family members, witnessing these changes can be deeply unsettling. It is natural to desire to help, to encourage deeper breaths, or to worry that an urgent medical event is unfolding. However, in many instances, this is simply the body's inherent mechanism of slowing down. There may not always be a means to reverse these physiological changes, but there are numerous ways to enhance their comfort. Keeping the room cool, utilizing a humidifier, or offering small sips of water can help alleviate discomfort. In some circumstances, gentle medications or supplemental oxygen therapy can provide relief. But the primary focus shifts towards providing solace rather than attempting to rectify an irreversible process. If you observe these particular signs, changes in breathing, cold hands and feet, or a bluish discoloration of the skin, it is paramount to pay attention. These are often indicators that the body is conserving its diminishing energy and that blood circulation is decelerating. This is a crucial time to be present, offer sincere reassurance, and cultivate a tranquil environment where they feel secure and at ease. In these concluding months or weeks, the most invaluable gift you can bestow upon them is not medical intervention, but rather profound comfort, unwavering dignity, and the reassuring knowledge that they are not alone. Comment, breathing changes, if this point resonates with your observations or concerns. Beyond the physical, the holistic perspective. While the 5 signs we've meticulously discussed, unintended weight loss, profound fatigue, cognitive shifts, frequent infections, and changes in breathing and circulation are undeniably critical physical markers, it's equally important to adopt a holistic perspective when supporting an elderly loved one in their final year. Life's concluding chapter is not solely a physiological process. It is a deeply personal, emotional, and spiritual journey. Consider the role of emotional and spiritual well-being. As the body declines, many individuals undergo a process of introspection and emotional preparation. They might reflect more on their life's journey, their relationships, and their legacy. This period can be marked by a heightened desire for reconciliation, forgiveness, or expressing gratitude. It's a time when old grievances might resurface or a deep sense of peace might descend. For some, there might be a profound spiritual awakening or a renewed connection to their faith. Providing opportunities for these emotional and spiritual needs to be met can be immensely comforting. This could involve facilitating conversations with clergy, supporting visits from cherished friends, or simply creating a serene space for quiet contemplation. Have you ever considered the spiritual aspects of end-of-life care? Comment, spiritual peace, if this perspective is new or meaningful to you. Think about the importance of reminiscing. As cognitive function may fluctuate, memories of the distant past often remain remarkably vivid. Encouraging your loved one to share stories, look at old photographs, or listen to favorite music can be incredibly therapeutic. These acts of reminiscence not only provide comfort, but also offer an invaluable opportunity for families to learn more about their loved one's life experiences, creating new shared memories even as the physical body wanes. For instance, a gentleman named Mr. Davies, an 88-year-old from Manchester, England, who had led a quiet life, surprised his family by sharing exhilarating tales of his youth as a merchant marine when encouraged to look through old photo albums. These previously untold stories brought immense joy and a deeper connection to his children and grandchildren in his final months. Have you ever tried reminiscing with a loved one? Comment, shared memories, if this idea appeals to you. Now, let's talk about the subtle art of communication during this phase. As we've discussed, verbal communication may become challenging. However, nonverbal cues become increasingly significant. A gentle touch, a comforting presence, soft music, or reading aloud can convey profound love and reassurance. Even when a person appears unresponsive, their sense of hearing is often one of the last to diminish. Speaking in a calm, soothing voice, even if you're unsure if they understand, can provide immense comfort. It's about being present, truly present, in the moment, and communicating through the heart rather than just through words. I believe you're enjoying this video and finding this discussion on holistic care enriching. Before we continue, make sure you subscribe, like, and share this video with others who might benefit. Comment wonderful if you're enjoying this video and feel its content is valuable. The role of professional support and advanced planning. It's natural for families to feel overwhelmed during this period. This is precisely where professional support can become a beacon of guidance. Hospice care, for example, is a specialized form of care that focuses on providing comfort and support to individuals and their families at the end of life. Hospice teams comprise nurses, doctors, social workers, and chaplains who work collaboratively to manage symptoms, provide emotional and spiritual support, and assist families with practical matters. They don't just focus on the physical. They embrace the entirety of the individual and their family's needs. Engaging hospice services, even in the earlier stages of the final year, can significantly enhance the quality of life for both the individual and their caregivers. This allows for a smoother transition, with expert guidance available around the clock. Have you ever considered professional palliative or hospice care? Comment support system if you recognize the importance of such services. Moving on, let's discuss the critical aspect of advanced care planning. This involves making decisions about future medical treatment and care in the event that a person becomes unable to communicate their wishes. Documents like living wills, advance directives, and appointing a medical power of attorney or enduring power of attorney in some regions can ensure that your loved one's preferences are honored. These conversations, while often difficult, are paramount. They alleviate the burden of decision-making from family members during a highly emotional time and ensure that the individual's wishes regarding comfort, resuscitation, and other medical interventions are clearly understood and respected. For instance, Mrs. Evelyn, a 92-year-old resident of Toronto, Canada, had clearly articulated her desire for no aggressive medical interventions in her final months through her advance directive. This allowed her family to focus entirely on her comfort and dignity, free from agonizing decisions about hospitalizations or procedures she wouldn't have wanted. Are you familiar with advanced care planning? Comment future planning if you believe in the importance of making these decisions proactively. Navigating the emotional landscape for caregivers. It's vital to acknowledge the immense emotional toll this period takes on caregivers and family members. Witnessing a loved one's gradual decline can trigger a wide range of emotions: sadness, grief, helplessness, frustration, and even anger. It's crucial for caregivers to recognize these feelings as normal and to seek support for themselves. This might involve leaning on other family members, joining support groups, or seeking counseling. Burnout is a real risk for caregivers, and neglecting one's own well-being ultimately diminishes the quality of care provided. Remember, you cannot pour from an empty cup. Taking breaks, engaging in self-care activities, and allowing others to assist are not luxuries, but necessities. Have you, as a caregiver, experienced these complex emotions? Comment caregiver support if you believe in the importance of looking after yourself. Let's discuss compassion fatigue. When you are constantly exposed to suffering and loss, it can lead to emotional exhaustion. This is particularly true for those who have been providing long-term care. Recognizing the symptoms of compassion fatigue, such as reduced empathy, irritability, or social withdrawal, is the first step towards addressing it. Practicing mindfulness, engaging in hobbies, and maintaining a healthy lifestyle can help mitigate its effects. It's about finding balance in an unbalanced situation. Moving on, let's talk about the gift of presence. In the final stages of life, often the most profound comfort you can offer is simply your presence. It's not about what you say or what you do, but simply being there. Holding a hand, sitting quietly by their side, or offering a gentle touch can convey more love and reassurance than any words. These quiet moments become the most cherished memories, imbued with a depth of connection that transcends spoken language. They are the essence of true companionship in life's final chapter. Have you experienced the power of simply being present? Comment comforting presence if you understand this profound aspect of care. Final reflections and moving forward. As we bring this comprehensive discussion to a close, take a moment to internalize the profound insights we've shared. Significant, unexplained weight diminution, extreme, unyielding fatigue, increasing cognitive confusion or withdrawal, frequent, persistent infections, and major, discernible changes in breathing and circulation. These 5 critical signs often emerge in the year leading up to an elderly person's passing. They may not all manifest simultaneously, nor may they always be immediately obvious. However, when you begin to notice these patterns, it serves as a clear signal that the body is preparing for its final, momentous transition. For many families, confronting these changes can be incredibly arduous to accept. It is an entirely natural human inclination to want to resist them, to encourage a beloved individual to consume more, to move more, or to push through their overwhelming exhaustion. But sometimes, the most compassionate and effective course of action we can take is to truly listen to what their body is silently communicating to us. Instead of focusing on futile attempts to reverse the inevitable, we can channel our energies towards making their remaining time as profoundly peaceful, as genuinely comfortable, and as deeply meaningful as humanly possible. Understanding these profound signs is not about succumbing to fear of death. It is about embracing preparedness for it. When you recognize these unfolding changes early, you are empowered to offer superior care, make critical decisions well in advance, and ensure that your cherished loved one's final months are imbued with unwavering love and dignified respect. This is a sacred period for cherishing every shared moment, for recounting treasured stories, and for unequivocally letting them know they are profoundly valued and never alone. If you are currently observing these signs in someone dear to your heart, take a deep, centering breath and remember, you are not navigating this journey in isolation. Countless families have walked this path before you, and while it is undeniably a challenging journey, possessing this knowledge can help you discover inner strength, cultivate profound patience, and ultimately find a sense of peace amidst the transition. Thank you for dedicating your time to join us today. We genuinely value your engagement and would be delighted to hear from you. Please leave a comment below and share one significant insight you gained today and how you envision applying it in your life or in your caregiving journey. Your perspectives are immensely important to us, so please do not hesitate to share them. Reading your comments provides us with tremendous motivation and encouragement to continue our work. If you found this video insightful, impactful, and helpful, we earnestly ask you to hit that like button, subscribe to our channel for more valuable content, and share this video with your friends, family, and social networks. Your unwavering support truly enables us to continue creating enriching content designed to inform and inspire you. Thank you for watching, and we eagerly anticipate connecting with you in our next video. And before you go, don't forget to check out some of our other interesting videos on the channel. There's so much more to discover. Remember to subscribe, like, and share.